Module 25, the diabetic athlete. Let's first take a look at glucose concentrations and see how we define diabetes mellitus using these values. Normal fasting glucose is considered less than 100 milligrams per deciliter, with the range of about 70 to 100 being the normal range for glucose concentration in the blood. Impaired fasting glucose is considered greater than or equal to 110 milligrams per deciliter and less than 126 milligrams per deciliter. However, you should be aware that there is tremendous debate in the diabetic world as far as if this should be even a category, and even within that, a lot of folks will debate what is considered impaired glucose. So this is just typical of what you may see out there, but there are variations on this, and people will have varying opinions on what the range should be if impaired glucose should even be a category. As far as diabetes, assuming that the impaired fasting glucose is the pre-diabetic state, and that's considered an official state, diabetes then would be any glucose concentration level greater than or equal to 126 milligrams per deciliter. What affects a type 1 diabetic's exercise performance? Well, first off, let's define the type 1 diabetic. The type 1 diabetic is the kind of diabetes that essentially the person produces low to no insulin from the pancreas. So their glucose concentrations are going to be quite high if they're not managed. So as far as exercise performance is concerned, this doesn't mean that they can't exercise. It just means that they have to be a little bit more cautious about the timing of insulin injections, etc. So they have to have a little bit more control, better control than the average person is concerned as far as introducing exercise into a regimen. So what affects their exercise performance? We've got metabolic and hormonal responses during exercise that are based upon the intensity and duration of exercise. That makes a difference. The higher the intensity of exercise, the longer the duration of the exercise, the more glucose that's going to be removed from the bloodstream. The degree of metabolic control before exercise. So are they managing their glucose concentrations appropriately outside of any of the times that they're active with their insulin, and the timing of insulin, and the type of insulin that's being introduced. So the type and the dose of insulin that's injected before exercise is very, very important. Is it a short-acting insulin? Is it a long-term acting insulin, or something in the middle? This is very, very important. The site of injection makes a difference. If the person is injecting insulin into their thigh and they're going to be exercising using their legs, that can exacerbate the uptake of glucose from blood into the working muscle, and then the person might become hypoglycemic if they overdose themselves. The timing of the previous injection is also important. The timing of the previous meal, very important here as well. The major determinant of glycemic responses during exercise are going to be then insulin availability. Is insulin around? We know that insulin is going to promote the uptake of glucose into cells. If it isn't around, are you in a hypoinsulinemic state? If we're in a hypoinsulinemic state, then that means we must be releasing some of the breakdown hormones that are going to release glucose from glycogen. So catecholamines, glucagon, growth hormone, cortisol, all of these are breakdown hormones. They're going to promote glycogenolysis. So you actually may get a higher response as far as glucose concentrations in the blood are concerned with hypoinsulinemia. And this can occur in a type 1 even with insulin present. So this is something that we want to watch out for. And of course, any practical considerations are of utmost importance as well. As you can see that I've got pictures here of people injecting themselves with insulin, but there's also insulin pumps. And the insulin pumps now are fairly small, so they're easy to transport and attach to a person's body, even with sport. However, is that pump going to interfere with the person's ability to perform well? These are the types of practical considerations that we want to take into consideration. What affects a type 2 diabetic's exercise performance? Let's first talk about what type 2 diabetes mellitus is. This is the kind of diabetes where there's plenty of insulin being produced, and in a lot of cases, there's hyperinsulinemia, so there's a lot more insulin. And so insulin is around and it's attaching to the receptors on cells. However, the cells are not responding with the movement of GLUT4 to the periphery of the cell to drag that glucose in. So they are considered insulin resistant. So there's something wrong with the second messaging systems intracellularly that just don't allow the GLUT4 transport protein to bring in glucose. So how does this affect their exercise performance? Really what we're talking about with the type 2 diabetic are going to be the complications associated with type 2 diabetes, particularly the uncontrolled type 2 diabetic. So if they have not done a good job at regulating their glucose concentrations and they're running high regularly, then they could eventually end up with problems like hypertension, neuropathy, so there's nerve damage, retinopathy, so there's eye damage, and nephropathy, kidney damage. So these are all considerations that you want to think about if you're working with a type 2 diabetic athlete. Some special notes about the diabetic athlete here is we want to be mindful of insulin manipulation for purging of kilocalories in type 1 diabetics. They could actually neglect to take their insulin, and then that's going to force more glucose to stay in the bloodstream, which then the kidneys would then flush glucose out into the urine, which it's not supposed to be under normal circumstances. So they can actually try and purge some calories that way. And so we do want to be careful of this with the diabetic athlete if they're suffering from some sort of eating disorder or disordered eating, and they're trying to regulate the amount of kilocalories that they're consuming.